UT Health Science Center will serve as the sole vaccine location for all UT Health employees in the area because that's where the specialized freezer is to store Pfizer's vaccine. After the first staff members got their shots, the hospital's president, Dr. Kirk Calhoun, spoke about the historic moment.
I really have three quick points I want to make. The first point is that the first tier of people to receive the vaccine are those workers who are taking care of COVID patients in our ICUs and hospitals and in our nursing homes and so forth. These people have been putting their lives at risk. We want to protect them as quickly as possible because without them, we would have no one to take care of us if God forbid, we would come down with COVID. The second point I want to make is the University of Texas is playing a prominent role in the distribution of the vaccine. 6:30 a.m. this morning, I was on the phone with the presidents of the other UT Health Science Centers. All of us today are engaged in vaccinating patients across Texas and working with other academic medical centers in the state. This is an important role that we play, and one of the reasons we were chosen to get the vaccine so soon. And then lastly, I just want to point out that this is a messenger RNA vaccine, the first time a messenger RNA vaccine has been used. Messenger RNA analogs were developed in research labs in academic medical centers around this country. Actually, we began developing them several years ago. This is the first time that they've been utilized to develop a vaccine. Usually it takes years and years and years to develop a vaccine. But because of this new technology coming out of our medical schools and academic medical centers, we now are able to develop vaccines that are safe and effective in a much more rapid fashion. And that's the real marvel of medical science, part of the reason I got involved in academic medicine.
And how does it feel watching so many of your colleagues and employees want to be the first in line to get it today?
You know, if you see the ravages of COVID-19, you'd hurry up and get in line also. Some people get it and have very mild or virtually no symptoms at all. But for those who are susceptible, it is a horrible thing to go through. We all know that it affects the lungs, but it affects the heart, it affects the brain, it affects several systems. And we still don't know what the long-term effects of COVID-19 are. So to get a handle on this so quickly, and I know we've been going through this for a long time, but as medical science goes, the new treatments that we've come up with, the vaccine that has been developed, both the Pfizer and the Moderna and others coming down the line, for us to have done this for a disease that last January none of us knew anything about, not a thing. For us to come up and be at this point so rapidly really is a testament to medical science in the United States. My concern has just been to make sure that we do a good job of it. And we still have a lot of work to do. These are the first steps we're taking in making the vaccine available. We want to take care of our healthcare workers. We want to take care of people in the nursing homes. We want to take care of our first responders. But the real challenge is how we're going to immunize our communities. And I particularly want to speak out to communities of color because this disease, COVID-19, has shown our health disparities and how communities of color can suffer disproportionately to a disease like COVID-19, and that's happening right now. So it is critically important that we reach out to these communities, alleviate any fears or concerns they may have about the vaccine, and get folks vaccinated. It is one of the most important things we can do to allow us to prevent unnecessary death and suffering and help us get our economy and our lives back to normal again.
You had mentioned earlier that, the vaccine, you said we're excited to get this because, and see essentially something that's going to return us to a normal. Do you think that's a real possibility?
Yes, ultimately, but not right away. For a variety of reasons, we need to continue to wear masks. We need to continue to wash our hands. We need to continue to social distance, and we need to continue to avoid large crowds. The reasons for that is that this is still very early in the vaccine's presence, and we're still learning, and we want to learn how long people remain immune, and whether your immunity to getting sick is the same as immunity for carrying the virus and passing it on. So that's going to take some additional research. People are already engaged in that kind of research, and I think we'll have the answers to those questions fairly promptly.